Today, we're diving into a systematic review that shines a light on a really complex condition, one that might just explain why some chronic pain feels impossible to solve. We all know someone, or hey, maybe it's you, who's dealing with persistent pain that just doesn't have a clear answer. Well, researchers are digging in, and they're pointing to a hidden disorder deep within the spine as a potential culprit. So what is this mystery condition? The focus of this major review is something called Spinal Adhesive Arachnoidopathy, or SAA for short. Okay, to get this, picture your spinal cord being wrapped in something like delicate cling film. That's the arachnoid membrane. Now, with SAA, inflammation makes that membrane get all sticky. It starts to form scars and adhesions that literally glue the nerves together. It's a mess. And here's a key thing to know. You might have heard of adhesive arachnoiditis, but that's just one piece of the puzzle. SAA is the bigger umbrella term for a whole range of these conditions. And you can see here, SAA isn't just one single thing. The classic form, adhesive arachnoiditis, is by far the most common, making up almost 81% of cases. But you can also have it with cysts or with calcification and fibrosis, which is basically a hardening of that scar tissue. This variety is a huge reason why it's so tricky to pin down. And that difficulty, it has a very real human cost. This review looked at over 500 patients and found that the median time from when symptoms start to when they finally get a diagnosis is a full year. Just think about that. 12 months of pain, of worsening symptoms, of not knowing what's wrong with you. So what does this condition actually look like? What does it feel like for a patient? And what in the world triggers it in the first place? Let's get into the symptoms and causes. Now, here's something that might surprise you. When you think of spinal problems, you probably think pain first, right? Well, for SAA, the number one most common symptom, reported by nearly 80% of patients, is actually abnormal motor function. We're talking about weakness in your limbs, trouble walking, even paralysis. After that comes abnormal nerve sensations, that numbness, tingling, or burning feeling. And then comes chronic pain, which is, of course, still a huge part of it. So what kicks off this whole inflammatory nightmare? Well, the review points to four main culprits. Physical trauma is the biggest one, followed by infections like meningitis. But look at the next two. Previous surgery, especially spinal surgery, and bleeding in the spinal area. They're also major causes. Basically, anything that irritates those super delicate membranes can start the whole process. And the complications from SAA can get really serious. For patients who have that most common form, adhesive arachnoiditis, there's a nearly 40% chance of developing another condition called searing amelia. This is where a fluid-filled cyst actually forms inside the spinal cord itself, causing even more damage. It's literally a disease that can cause another disease. Okay, so this brings us to the really practical stuff. Given how awful SAA can be, how do doctors even find it? And what on earth can they do about it? The diagnostic journey today pretty much hinges on one powerful tool, the MRI. It's used in about 80% of initial screenings and nearly 70% of final confirmations. Sure, there are other methods, like a myelogram where they have to inject dye into your spine, but the detail you can get from an MRI without being so invasive has made it the absolute gold standard for spotting these adhesions. Now, when it comes to treatment, the data shows a pretty big difference. The study found that patients who had surgery, usually to go in and try to free up those tangled nerves, reported an improvement rate of over 84%. That's way higher than the 51% rate for people who got conservative treatments, like steroid injections. But, and this is a huge but, the researchers are quick to point out that surgery is also one of the causes of SAA, so there could be some selection bias here. It's a real balancing act. All right, let's pull back for the big picture. Why is it so crucial to talk about a condition that, for a long time, was considered pretty rare? This quote from the study really just nails it. The symptoms, pain, weakness, numbness, they're not specific. They can look like a dozen other common conditions. And because of that, patients get misdiagnosed or their condition is missed altogether. That's how you end up with that year-long wait for answers we talked about. This research is a massive wake-up call for doctors and a reminder for anyone with these unexplained symptoms, especially after a back injury or surgery, that SAD-A could be a piece of the puzzle. And that really brings us to the final critical question. We live in an age where spinal surgeries and other interventions are getting more and more common. And as we just saw, those procedures can be a risk factor for SAA. So the challenge is, how do we make sure our ability to diagnose and manage this incredibly complex hidden disorder keeps up? What's it going to take to finally bring it out of the shadows for good?